Hello, thank you so much. I'm really looking forward to this presentation with all of you, and I really appreciate being invited. And I've very much been enjoying the session so far today. Thank you for including me. So I would like to take the time to tell you just a little bit more about me. Thank you for that lovely introduction. I am a registered dietitian, and I have been for almost 20 years. Next year will be my 20-year anniversary of practicing as a dietitian, and I do have a PhD in nutrition as well. I used to live in Toronto, but a few years ago I moved to the mountains in Nelson, BC with my vegan partner, and I'm raising my 4 children on a plant-based diet. And we love to cook together and bake vegan food. And I have an online private practice where I work with people across Canada. I'm registered in BC, Alberta, and Ontario, and I work with people to help them optimize their nutrition. And I do see a lot of mental health issues in my practice. I do believe that nutrition is an extremely important part of optimizing our mental health, and especially since the beginning of lockdown, I am noticing more interactions between nutrition and mental health, and I'm very much wanting to speak about this topic, especially to seniors who may perhaps have been experiencing some more isolation than they're used to, more difficulty perhaps in accessing groceries, facing a lot of issues that are impacting your health and your nutrition and your mental well-being this year. And I've seen that in my practice and even in my own family. So I think it's an important issue to talk about and something I'm very pleased to share about today. So I'm just going to cover an outline of what I'm going to talk about today. The first thing, I'm going to give a bit of a framework for how I see nutrition and mental health interacting together, talking about some key nutrients and foods that can help us improve our mental health, talk about the role of the microbiome in mental health, and then talk through some next steps. I also want to let you know that if you have questions during this presentation, I believe that you can use the button to raise your hand and ask a question, or you can type the question. The question will go to the moderator, and I will have the opportunity a few times during this presentation to answer questions, and I also will be available to answer questions at the end of the session. So please don't be shy. If a question pops up for you while I'm speaking, just go ahead and use one of those methods to interact with me, and we can have an opportunity to answer your question and to dialogue together. So I want to introduce this framework for how I see nutrition and mental health. First of all, there's food. Now, food is so much more than just nutrition. Let's never just try to say that food is only about nutrition. Otherwise, you know, if you could just take one pill a day that provided all of your needs and you would never have to eat, would you take that deal? I don't think many of us would, because food is pleasure and enjoyment. Food is culture. Food is family. Food is self-care. Food is so many of those things, but it can also be hard work. Sometimes it can be very challenging. Knowing what the right thing to eat is can be difficult. And sometimes our relationship with food and our bodies can become quite complicated and maybe even unhealthy. So food is definitely part of this framework. But then nutrition is also part of it, as in, is the food that you're eating actually meeting your nutritional needs? And then how well are you actually absorbing and able to use the nutrients in the food that you are eating? Because not everything that we take in necessarily gets well absorbed, and the health of our gut and our microbiome are very important in helping us to use the food that we eat, and we'll talk more about that today. Another issue is medication. You may be on some medications for your physical or your mental health. Medication sometimes interacts with your food and your nutrition. But I also want to stress that medication can be an important part of achieving a healthy mind and healthy body. And so I never want to give the impression that food and nutrition alone are the solution for mental health. Food is one important pillar of having a healthy body and healthy mind, but medication may also be an important part of that for you. And there's nothing shameful about using medication to support positive mental health. Also, therapy may be an important part, and therapy may take many different forms for you. For example, the breath work that we were just doing together is a type of therapy. And also perhaps working with a therapist, talk therapy, cognitive behavioral therapy, so many different kinds of therapy that may be useful to you in improving your mental health. Another important pillar of mental health is activity, and it's also important for us for our nutrition in terms of how well we absorb the nutrients that we eat. Our activity actually has an impact on our digestion, and also the more active we are, the more food that we need to eat, and we need specific food to help us build and maintain our muscle mass, especially as we age. Particularly proteins, plant-based proteins are recommended now by Health Canada that we should be choosing plant-based proteins more often. And next, social. So events like today can very much be part of our social network in ensuring that we are getting the support that we need to boost our mental health, and that we feel supported, our families, our friends, people that are within our bubble that we interact with regularly. Perhaps care workers may be part of that for you. But there's no doubt for all of us that our social networks have changed as a result of COVID and new restrictions that have been put in place this year. And that certainly can impact your mental health. And good for you for joining this seminar today. Just one more way that you can protect and better support your mental health. So let's talk about some specific foods that can be beneficial to your mental health. So first of all, I think fruits and veggies come to mind as at the top of the list, really, for benefiting our mental health, especially raw fruits and veggies that are very rich in antioxidants. The guidance is to fill half your plate with fruits and veggies. Now, that may seem a little overwhelming. Fruits and veggies can be heavy to carry. They can be expensive. It can maybe feel daunting to try to eat that much, have a big volume on your plate. I want to encourage you that although we are advocating as health professionals for you to have half of your nutrition coming from fruits and veggies, that doesn't have to look like a big salad on the side of every meal. It can be a soup or a smoothie. We're certainly into soup season now. And so reaching for soups, smoothies that contain fruits and veggies is a great idea. And adding fruits and veggies into your meals. Now, here is a good opportunity to use some frozen veggies. People often will ask me, are frozen veggies really nutritionally adequate? To be honest, they are almost as nutritious for us as freshly picked vegetables that we get from the market, and really sometimes they even might exceed the nutrition from the vegetables you're buying at the supermarket, because they tend to be processed and frozen immediately when they're picked at kind of peak of freshness, as opposed to vegetables which perhaps are transported over long periods of time and may lose some of their nutritional value in transport. But I don't want to worry too much about those things. Whether you enjoy fresh or frozen vegetables doesn't matter too much, but it's more about making sure you are finding ways to incorporate those in your diet. If you enjoy starting your day perhaps with a nice big bowl of oatmeal with chia seeds and blueberries, that's a perfect start to the day, or a smoothie, a fruit salad beside perhaps overnight oats or avocado toast. That doesn't have to be food that only millennials eat. You can also enjoy those foods. And even if you prefer maybe say a bagel in the morning or English muffins, that's fine. But try and find ways to add in some protein-rich foods like nut butters, seed butters, and also some fruits and veggies. If finances are an issue and you're concerned about that, go for the frozen veggies. I really enjoy keeping frozen kale. There's a new blend at President's Choice, which I think is zucchini and kale and collards in one blend. And I add that into so many soups and stews. The vegetables are riced so that they're very, very small, and they blend very easily and nicely into your soups and stews and pasta sauces, for example. And you will hardly even know that they are there, but you will be getting a lot of nutrition from them. Also, remember that locally grown in Canada vegetables are still available throughout the winter. Beets, carrots, apples, cabbage, potatoes, sweet potatoes are great value, inexpensive, and still locally grown and available in the wintertime. However, I do know that they are heavy to carry, so maybe choose to order a larger quantity of those. They keep very, very well and will keep for a very long time if they're kept in sort of a cold storage area, and they will keep for months in some cases. Or you could, prepare soups or stews or purees with them and then freeze those if you have access to a good size deep freeze.